Great. Good evening. Darker and darker, hey? Well, at least I think the last time the heavens had opened up just as the meeting started. So I'll take this over thunder and lightning any day. Welcome to the Children and Young People Scrutiny Commission meeting of November. So this is a formal meeting of Hackney Council, and all the usual constitutional requirements of council meetings apply. And I remind members and officers that this meeting is being held in public and is being broadcast live via the internet. The rights of the press and public to record and film the meeting apply, and everyone present should note that media representatives may be in attendance or viewing the live stream. Moving on to item 1, apologies for absence. We have apologies from...
We have apologies from Councillor Benny Lubbock, Councillor Sizer, and Richard Brown.
Thank you very much. Moving on to item 2, urgent items. Do members have any? Sorry, we don't have any urgent items, and the agenda will be as published. And then item 3, declarations of interest. Do members have any declarations of interest? I'll start with you, Jo.
Hello, I'm a governor at St Thomas Avenue School, and I am a parent of a child with SEND in Hackney.
Thank you, Jo. Any others? Okay. Thank you very much. Moving on to the first substantive item of the evening, which is the Children's Social Care Activity. So the Children and Families Annual Report is presented annually to the Commission. However, this was not available to be included within this agenda. Therefore, a brief summary of children's social care activity for the period 2021-22 is presented in the report pack at page 11. A budget monitoring report for Children and Family Service accompanies this report so that members can scrutinise policy and budget priorities and considerations in alignment. For this item, we have Diane Benjamin, the Director of Children's Social Care, and Jackie Burke, Group Director for Children and Education. We have approximately 40 minutes for this item, so can I ask the Director of Children's Social Care to briefly highlight key aspects? You've very helpfully included a summary also, so please have that in mind that we've read that. So very brief overview so that we can go straight into questions. So over to you.
That one, thank you. Thank you, Councillor Conway. Obviously, you've all read the report, so there are some brief highlights that I'd just like to make if possible. So this is a brief overview of our key performance headlines to date. Just wanted to bring your attention just a couple of things in terms of our increases of referrals. So 27% of increases of referrals have been received from this year, 15% a decrease of assessments, etc. And I know you read all of this, but just some of those key highlights for us. So 15% of decreases of assessments have been completed. This in part we believe is due to the strengthening of our early help services and all contacts being converted, not all contacts being converted into assessments, so the strengthening of our early help provision. We've got 405 children looked after as of September this year. There's been a decrease of 6% of our looked after population from last year. This time last year, that was our highest was 431 children. So there's been a real decrease. A lot been done in terms of strengthening why children are coming into care, in terms of the front door, in terms of the back end of the service. 15% of our looked after children have moved, have had 3 or more moves of care arrangements compared to 10% of the last year. This is going down as compared to 14% in September this year. Again, we think the move is due to the pandemic. There's lots of changes of placements, etc. We believe the increase of our looked after children, although this is going down from 431, our hypothesis is that the family stresses during the pandemic, and that's why we saw an increase. We weren't seeing the same increase, certainly other local authorities weren't seeing the same increase, but we are now seeing that increase in terms of our children in care population, just going a little bit higher in terms of our population of our care leavers. So some of the things I also wanted to highlight in terms of our staffing, in terms of recruitment and retention, we've got a really clear strategy in place. As you can appreciate, the competitiveness of keeping staff, experienced staff has been a real challenge, not just for Hackney, but just across London in general. We have the London Pledge that's now in place. Again, most of our London local authorities are signed up to that, but it is a real challenge in terms of making sure we've got experienced members of staff and experienced staff that want to stay. So hence we've got a really good tight recruitment and retention in place at the moment. We are also working with Pan London just in terms of some of those shared costs with looking at a resource. It's still in pre-arrangement at the moment, but at the moment, providers, as you can appreciate, is really, really challenging in terms of we're competing with all our other London local authorities in terms of placement. So providers, it's a very, very competitive market at the moment. So those are some of the things I just want to bring to your attention. Any questions?
Thank you very much. Do members of the Commission have any questions? Go ahead. Can we take a couple at a time? Councillor Suso-Rungo.
Thank you. Thank you very much for that. Could I ask if there has been, as there has been a change in the demographics, in that there is a disproportionate number of adolescents entering kid care, how has staffing and services adapted to meet the needs of this cohort? Could you delineate that a little bit more? Thank you.
And then can we take another question from Councillor Selman, please?
Hi, no, it was just on the bit about that juxtaposition between the increase in referrals, but then decrease in some of the other sort of measures. And I think you mentioned that you're potentially attributing that to the strength of the early help offer. And I just wanted to know if that was sort of a hypothesis of what we think is going on, or if we've done actually analysis, or how do we know if that's the case? Does that make sense? Thanks.
So in answer to the first question, I think just in terms of the adolescents that are coming into care, I think we've got a really good youth-based offer in terms of our Young Hackney. So I think that's absolutely really strengthened and really helping. We've got contextual intervention unit that's also helping as well in relation to that. I think I am worried about my adolescent cohort, absolutely. But I think practitioners are aware of those challenges with adolescents. My ambition is for them to not have as many adolescents coming into care, to be kind of looking at what the issues are at the first stage as opposed to them needing to come into care. So I think it's a hypothesis at the moment, just in terms of the Young Hackney offer, the contextual intervention offer, and hopefully them working together to do that.
If I may, we invited the Local Government Association to do a review of our work with adolescents. It was earlier on this year, and they were very complimentary about the investment that we've made in our young people, as were Ofsted when they visited. Young Hackney, it manages to spread itself into many places, so it works alongside Diane's statutory services, it works alongside secondary schools, it works in the youth centres as well. And what we're acutely aware of with our adolescents is the disproportionality. So in terms of our response to those young people, we are really drilling down into the data, drilling down into the qualitative experience of children when they're coming to our attention. Because they looked after cohort of late entrance into care. 13. It's 13 and upwards, and there's a disproportionate number of Black and mixed heritage boys in that cohort. So, and that's we need to get the system to work with us and around those boys so that we can keep them in their families, in their schools, and in our communities.
Yeah, Councillor Gordon, I think, and then Salma.
Thanks for that. Can I just have a quick follow-up in terms of data? I totally appreciate that you've identified as a disproportionate amount of young people from global majority families. What other data are you looking at in relation to this cohort of young people? Do you have sort of information in relation to whether they've got special educational needs or disabilities, and also in relation to the sort of incomes and family background? I mean, I think it would be really, I'm sure there must be sort of multiple factors in relation to these children coming into care, and I think that it'd be really helpful to have as much data and analytics as possible in relation to this cohort of young people.
And just to add on to that, actually, just it would be helpful, given that we're also seeing a decrease in the number of children that are becoming looked after. It would be interesting to sort of know what the demographics, if we're doing things that we feel are resulting in fewer children coming into care, who's now less likely to come into care. Are the disproportionalities even more visible, or are they less apparent? Is there any sense that any of the work that we're doing around anti-racism may actually be having an impact on the numbers of children from Black and global majority backgrounds who are coming into care? So yes, can I just bring Salma in, and then
that one, yeah. Thank you. So you spoke about the challenges of the workforce. How is Hackney's offers to social work staff unique or different to other authorities, which might make the service comparatively more attractive to possible new recruits? Also, the wider package offered to social workers.
I'll respond to the question on the data. So in terms of the children's social care data, we frequently do thematic analytic audits of cohorts of children. So we have suites of information that we interrogate. We also look at our complaints to see what information that tells us about how we're working with children. We don't routinely collect information about socioeconomic status from families, but we do connect information using the DFE census data around ethnicity. So we are able to cut the data, and we do look and use ethnicity data to help us understand who our children are, where they're coming from, and also just in terms of the way that we're looking at delivering services in future, and we're looking at the footprint of the Child and Family Hub. So we've definitely used the kind of referral data in our system to help us understand where we might need to focus our resources. In terms of our children with special education needs, that will be on our Mosaic database, but as you'll be aware, you may or may not be aware that education's on a different system owned by the same provider. Ultimately, we will end up with a system where we're kind of a single view of a child, but because of the cyber attack and because of the huge amount of work Diane and her team did in children's social care to restore back to Mosaic, we haven't yet been able to focus on Synergy, which is the education database. What I'm very happy to report is that our colleagues from Hackney Education moved out of the education building this week and have moved into the Hackney Service Centre, and all of the social workers and the social care staff have moved on to the third. So they're all on the third floor, all together, and happy to report that they are talking to each other about children and moving around the offices. So we're hoping there's going to be less email traffic, more conversation, more relationship-based approaches. And I think it's the start of us having a greater synergy between education and social care. And the data and our business intelligence, you may also be aware that we've created a new directorate under my group of directors, and it's outcomes, business intelligence and strategy. And with the whole thing is to bring together the data and the business intelligence from across education and social care, so that we've got a rich and more single view of, of a child, but also it enables us to understand all of our children, not just through a silo of educational social care.
Just to come in briefly on that, that sounds really, really encouraging. But on the point about not collecting any information about sort of socioeconomic, any socioeconomic sort of data, given I think the pressures that our families are facing, what comes to mind for me is that how are we testing the efficacy of our other strategies across the council? I think if we're able to see that, people who was it Theresa May who called them just about managing, the people who, had maybe been just about managing have been tipped into not managing at all. And, would it be helpful for us to see, to be able to capture that data and to see the impact that some of the challenges, the cost of living challenges that we're seeing families facing is having in, sorry, Councillor Gordon.
Just to add very, very briefly, I mean, also the impact of housing stress across every possible tenure of housing is at its absolute sharpest on families, particularly growing families. So I think it would be, it would be really helpful if there was a way of, in due course, seeing how the policies and effective housing and and what how the impact of the housing stress on our families.
Yeah, I was just going to mention in terms of potentially getting that data, I think one needs to acknowledge that we've just got back on Mosaic in April, and getting our systems that sophisticated is going to take time. So it's ambitious, but it's potentially achievable in terms of getting that data. But just in relation to that point, our supporting families agenda is working really, really well, and those are the families that we're catching. Because we're supporting families with that agenda. There is a really, really good audit trail in terms of, making sure that we support those families, we review those families, and we've got to be clear about, there's a term that's used in terms of payment for results, and we've got to be clear, if families don't come back to us, then we get payment. So for me, that's a really, really good audit trail in terms of being able to trace those types of families to make sure they're not coming back into the system, because they start off in early help, and so that support is there. It's really robust. It's really strengthened. One hopes they don't then escalate into statutory services, which we've got 98% of them don't at the moment. So it seems to be working at the moment. So I think that's potentially those families that we're catching. I just wanted to go back to that question, if I could, just in terms of the workforce. So it's the same kind of challenges that my colleagues across London are seeing. I can particularly talk about East London colleagues. They're seeing the same kind of challenges in terms of the workforce. What we're doing for Hackney at the moment, we need to have a USP. We need to have a unique selling point in terms of our offer. So worked really, really hard in terms of that recruitment and retention, but did that with the staff in terms of what they wanted. So this month, December, tomorrow, we've got a market supplement that's just been launched, and it's about catching our social workers in the front door, because that's where our challenges were. We weren't getting experienced social workers in the front door, or if we were getting them, they were leaving and they were going to other local authorities that were just charging, £5 more in terms of that agency rate. So we've got a market supplement that's launching tomorrow. We're also bringing in a senior social worker role as well, because again, our exit interviews were telling us that not all social workers want to be managers, but they want to progress their careers. They were leaving to go to other local authorities to get that senior practitioner role. So that's been brought in as well. Probably going to launch that in the new year, January, which means gives the opportunity for current existing social workers who've got the skill set to move into senior social worker roles, whilst also looking at recruitment and bringing in some really good talent as well in terms of that senior social worker role as well.
Thank you very much, Diane. We've got Councillor Ross and then Joe, please.
Thank you. I just wanted to go back to the referrals. I think Councillor Selman asked a question about that as well. I'm not sure if it was been responded to as yet, but I just wanted to add, in terms of the increase in referrals, I think you mentioned today that, and in the written report, that you kind of put that to COVID or the pandemic primarily. I wanted to ask if there's, what other contributing factors do you think there were or are that has kind of made that increase come about? If there's anything kind of locally or anything in terms of our kind of local policy, or is it just really the pandemic? And also you mentioned that it's only Hackney, I think you said, that's seen an increase. Could you just go into that a bit more, into why that is, please? Thank you.
So
can I just take one more question from Joe, please? Sorry. Joe?
Thank you, Chair. The Commission's undertaken a number of site visits to local schools over the last few weeks in relation to connected work. And the accessibility of children's social care services was raised in a number of those schools, in particular the issue of social care thresholds, and the difficulty in obtaining support for children they believe to be in need. Given the centrality of local schools to the identification and referral of children in need, how does Children and Family Service work proactively with schools to develop awareness and improve referral rates? And it's really encouraging to hear about the increased synergy and colleagues from the two services working in the same building. But my question, I suppose, is how do you see that closer working relationship assisting partnerships on the ground in schools themselves? Thank you.
So it was the question around referrals and the increase of referrals. During the pandemic, Hackney didn't see an increase, and now we are seeing the increase. I think the hypotheses were, we don't have one because families, we just weren't getting the same, you know, my neighbouring boroughs, their referral rates had increased, but we just weren't, but we are seeing that now. So I think the hypothesis potentially is that, you know, we are seeing need, you know, our partners that are referring are now referring in more, but during the pandemic, our numbers were significantly lower than our neighbouring boroughs at the time. So, you know, it's an ongoing hypothesis for us as to why. So I think we are seeing that increase now. I think that increase is good because I think the need is coming through. As you can appreciate, the need is, you know, varying from neglect to domestic abuse, to child safeguarding to neglect, etc. So I think for me as a director, I'm curious all the time as to why that was, but I don't think I could give you any granular detail as to why at that particular time, because when I came in a year and a bit ago, referral rates are really low in comparison to my neighbouring boroughs, and now we are statistically on par with our neighbour in terms of the rate of referrals coming in.
I just feel as though Councillor Selman maybe has, because the questions were linked. Do you have a follow-up?
The question you asked earlier?
Yeah, so the initial question, because I think it got a bit lost in the other stuff, which was just that bit of, I think we were
How do we know?
How do we know?
So how we know is we have streamlined our referrals into our early help service. We've created a consultation line in the multi-agency safeguarding hub. We've also created an early help hub, and we've added additional staff into that, and it's become more multi-agency for education staff in there. So we know that when referrals come into our MASH, they're screened and they're sent to the early help hub, who then will, we work with children's centres as well as with our in-house early help services, and we also signpost people to other support, because there's lots of support in Hackney. It's not just about what the council does. So I think sometimes people who, we don't call it referral form, we call it request for support, because often when people refer, it's over to you. You know, it's your problem now, get on with it. And I'm not saying that's what everyone does, but if it's a request for support, there's an assumption that whoever's a professional has already been doing some early help with that child and that family, and they're inviting us to add some additional support. And it doesn't have to be a statutory social worker. I think sometimes people feel that's what they want is a statutory social worker. It's not always the best thing for families. The families often respond better to different forms of help. So how we know that we're getting our thresholds right is Diane has a very robust quality assurance service, and particularly when we set this up, I mean, I have a fortnightly early help board meeting where we're going through the implementation of our new systems and making sure that it's coordinated with the child and family hubs we're developing and the children's centres. So there's regular dip samples of thresholds. There's regular conversations. So, for example, twice a week, our colleagues in the Early Help Hub and the MASH, they meet with colleagues in the CAMS. They've set up a single point of access. So they meet to discuss, this is coming, we're not sure where to go. We think it might be few. So we're working really hard, and so we've got education colleagues also in the Early Help Hub. So we're working really hard to provide a more holistic response and to make sure that children get to the right service. So we think that our thresholds are pretty robust, that our levels of need are pretty robust. You will be aware as well, you'll have had an opportunity to see the letter that Ofsted published. So they came and spent 2 days in our front door services in September. They also agreed the language they used around the application of thresholds and the management oversight of that was very positive. So I think it's always a constant dialogue with colleagues, because I know that our colleagues in schools have seen a rising level of need as a result of the pandemic. I'm delighted the way that our colleagues in schools have responded to this, and you'll see how well, particularly when you think of primary school children, how amazingly well our Key Stage 1 and Key Stage 2 children did, and also our results for our 16 and 18-year-olds in Hackney secondary schools this year. It shows what an amazing effort our colleagues in schools made to ensure that children can't learn if they're not safe and well and supported and feeling okay. So colleagues in school have really stepped up as well with their support around children.
And was there answer to Joe's question around, so that was about, it was about we'd gone into schools and spoken to schools. So I think you've sort of touched on it to some extent when you were speaking about thresholds, but they had reported to us that they felt that they'd experienced it becoming increasingly more difficult to get help from children's social care, and that it was their perception that thresholds perhaps had increased, and what you envisage the teams, the two departments now working together might be able to achieve in terms of promoting better partnership working in that regard. See Paul's hand up. Did you want to come in on that one?
I'll just answer that question briefly if I could. I think it is about that synergy, about working together more. I think there'll always be those challenges with threshold. Certainly children's social care, we have a consultation line that is predominantly used by education. I think 68% of that consultation line is used by education, where we're having those challenges and conversations about referrals and whether something should be a referral or not. Work with DSLs, I've got colleagues, heads of service that work with DSLs really, really well. So I think there is the challenge, and I think we need to rise to that challenge in terms of how we can work slightly better in terms of, you know, those thresholds, decisions, etc.
Thank you. Paul, did you still want to come in?
Thank you, Chair, and thank you, Jackie. Chair, just following on from the comments of Jackie, and as I say, with regards to the work of what we're doing and the synergies, the benefits of having education and social care working together, actually that shared space leads to more conversations and leads to actually early identification of risk at the foundational stages of concern. So rather than having formal processes where things are having to be escalated the whole time, the ambition is that we'll be able to meet the needs for more children and young people earlier down the level of need, as it were. Our schools, there are challenges. There's absolutely, there can be no denying that with regards to thresholds and being responsive fully to needs. But there are other services. We've strengthened the work of the re-engagement unit as well. Additional capacity has been put into that. So it's not just a focus on the work of our children's social care team in terms of as a pathway out, in terms of once services are requested for support. We've strengthened our interface in other areas as well. And ultimately, as Jackie has said, the front door, if you like, children's social care, were subject to scrutiny, significant scrutiny recently by the regulator, that is Ofsted, actually looked at our work as well in this space. So whilst we don't just work to the Ofsted exam questions that they set us, absolutely we have to be responsive to the needs of our local schools, our local children, young people and families. But there's no denying there's more work to be done, but we're always endeavouring to make best use and efficient use of what resources we have at our disposal. But it's an ongoing challenge, but we do have mechanisms in place, or hopefully more and more, to identify those children at risk of poor outcomes, to identify those children in need as well, to try to ensure that no child is left behind or slips between the cracks. But hopefully, if our systems and processes are fit for purpose and responsive to need, as the regulator challenges us on, we will endeavour over time to design out some and more of those risks that potentially could be identified.
I have to say something that's coming to mind for me about the fact that we were a bit of an anomaly during COVID in terms of not seeing the same number of or increase in referrals as our neighbouring boroughs, is that it suggests to me that the pandemic had sort of exposed a weak point potentially, or also the main thing that's coming to mind is the cyber attack, I have to say. And I suppose there's a curiosity on my part, as I'm sure there is on yours, about knowing what we don't know, because it feels as though there's quite a lot that we maybe don't know about what happened then. And especially if now we're seeing an increasing number of families coming in, you know, has there been any work done to sort of explore whether these are the families who perhaps needed an early help offer 2 years ago, but somehow just didn't get through? And what that, you know, I appreciate that we're still trying to heal from the cyber attack and
Yeah.
still very much impacted by it, but it feels as though there's an opportunity to learn that something was maybe out of, that just wasn't able to sort of pick up those families at that time.
I think it's always difficult to know, but I think that has to be a working hypothesis for us, and it is. And I think, you know, the families that are coming through now, you know, in terms of thinking about need, I think the need is, you know, challenging to say appropriate, but I'm not sure if we'd have picked them up 2 years ago, whether it would have been different. And so it's a challenge, and it's a difficult one, and we're always doing lessons learned for us in children's social care in terms of what was it, you know, during that period that, you know, the referral rate just wasn't as comparable to our other local authorities, but it is now, and it's comparable now. You know, we are seeing, you know, as per 10,000, you know, that it's the same numbers in terms of referral, but it's something constantly thinking about in terms of, you know, and I think that you're right. I think the cyber attack had an impact, but, you know, was that in its entirety? I'm not sure.
Can I have any other questions from the Commission? Oh, sorry, Jackie, you wanted to come in, and then Councillor Gordon.
So our children weren't in spaces where they were being seen. Women were labouring on their own, they were birthing alone, they were bringing their babies home alone. They weren't able to access the normal support new mothers, new parents would access. Kids weren't in the early years settings, and they weren't in schools. So obviously need was not going to be identified and picked up and people signposted as they would do and as they are being now. So I think now what it's testament to is that the places children in Hackney are being seen, their needs are being identified, and they're being appropriately referred into services. So in terms of the levels of need and the threshold for whether it goes into early help or statutory services, I think the majority of families would rather they were helped through non-statutory services and were able to access a more family support offer. And that's very much the road that we're going down, which is why we're doing fewer statutory assessments, even though we've got a greater number of referrals coming in. But, you know, kids just weren't being seen during the pandemic. And the fact that our referral numbers are up just shows that our colleagues and our peers are vigilant and know what to do.
Thank you very much. Councillor Gordon, did you want to come in, and then Councillor Ross again, please?
Thank you. Yeah, I just really want to sort of maybe move the conversation on a little bit to residential and secure accommodation. So there are widespread concerns nationally about the availability of residential and secure placements for children. I just really wanted to know what sort of Hackney's experiences of this have these impacted on the social care provision for our children. I mean, obviously, it's never a first resort to move children, for children to have to be moved to these provisions away from the borough and away from our communities. If you could tell us a little bit more about how those decisions are made and what sort of accommodations are available, and whether you've explored any sort of options with neighbouring boroughs in relation to finding options. It would be good to know as well, I think, about the sort of, you know, in general, the sort of numbers of children who are in these placements and how, who they are and how long term they are. I think we'll be obviously going back to these questions in relation to the budget monitoring, but it'd be good to know a little bit more about those challenges. Thank you.
With that one for now, because there are a few elements to it.
I think our ambition is always foster first. And I chair a weekly meeting of children coming into service and placements being needed. So our ambition is absolutely foster first, and that's foster placement first. Your answer in terms of the quality of placements when we can't place children locally, it's a challenge, it's competitive. We try not to place children more than 20 miles outside of Hackney. Again, it's a challenge. If I'm concerned about anything, it's the quality of the placements that we're placing children in. You know, we do vigorous quality assurance checks because we have to. But I think because the market is so competitive at the moment, you know, it's about the needs of the children and the providers and the resources being able to meet those needs. What tends to happen is we find a resource, but we're also putting additional support as well to make sure those needs are being met for children. For example, sometimes children going on a 2-to-1, or because of emotional dysregularity, some children are needing a 3-to-1 support. So we're going to, you know, we're plugging the gap of the providers that don't necessarily are unable to kind of necessarily meet that need. So it's not something I would necessarily be advocating for our children, but I think in the current climate, in the absence of quality placements, it's something that we have to consider. I don't like placing children too far out of Hackney because you have to think about school, you have to think about their, you know, connections, you know, the family support, and all the support that they, you know, to remove a child from Hackney, from everything now to place them in my part of the world, Bradford, for example, it would be alien for them. So it's my least preferred option in terms of, but sometimes I don't have a choice in terms of what's available currently.
Thank you. Yeah, I understand that there's a children's social care sufficiency strategy in an embryonic stage. Can you let us know when that's going to be published and when we'll, you know, be able to hear more about that?
It's with me at the moment, so I'm reading it at the moment, and I think it's to go to Corporate Parenting Board this month. 13th of December.
Thank you. I don't think we had an answer in relation to the numbers. I don't know whether you know that or whether you want to.
Not off the top of my head, no.
Yeah.
No, in terms of numbers.
Yeah.
It would be helpful if we could get it outside of Hackney. Well, I mean, residential placements, how many would be in Hackney?
Yeah.
Maybe that would be an easier present. Any? No, there's no children's homes in Hackney, so they're all outside of Hackney, but I suppose that finding out how far away they are. I'm actually interested, Diane, because the sense that I'm getting from what you're saying is that most of these children could have been fostered. Because it's interesting, because another narrative, that might not necessarily be what you're saying, but another narrative has also been that some of these young people need to go into residential settings because foster carers are unable to meet their needs. But it would be interesting to sort of know what the distinction between the two is, because one is driven by the fact that we've got challenges in recruiting, in particular in-house foster carers, and the other is driven by something quite different. So in our attempt to presumably bring down the numbers of children who are going into residential placements, not least because of the cost, but also because there's a recognition that being in foster care is preferable, it would be helpful to sort of know what those main drivers are.
Yeah, and the reverse of that is when we've got children in residential, we are actually stepping children down from residential into foster placements, and that's proving really, really successful. But I can get you the numbers in terms of how many children are in residential, what that breakdown is in terms of gender. I can tell you we've got more boys and we've got more black and global majority boys. I know that, but I just don't know the numbers. But I can get you that. I can get you that detail.
Thank you. Then Councillor Ross, please.
I want to ask whether the full report will provide some further detail and data in regards to the needs that are presented, request for support or referral, and also in terms of the pathways that they're then that children and families are then placed on at that point in time. Would that be in the full report? Be in there?
Are you asking if that data is available currently?
Yes, and if it would be in the report.
Yeah, because it's coming in through the system, and I know where it's going, etc., and I know what that percentage is. So yeah, it's available. Yeah.
Okay, so
yeah.
So you have a kind of breakdown of the different kinds of needs as
Yeah,
well.
yeah, I've got the needs, I've got the themes, yeah.
I think Councillor Ross was also asking if we could, if that would be contained in the annual report.
Is it currently? Yes, it should be. Yes, yes, it should be. Yes, I believe it is. Yeah.
Unless anybody else has any other questions to ask, I think we might bring this item to a close. What I'm going to suggest, provided that members of the Commission are in support of this, I know that we will get to see the published report in due course. We don't really have space on our work programme this municipal year to look at that in its entirety within a meeting. So what we suggest is that perhaps that is on the agenda for us to note as a commission, but that we offline can go through that report and pull out any things that we feel need any further scrutiny. And it may well be that they are then picked up in subsequent sort of items or in the next municipal year. But at the very least, we would then forward some written questions onto you, which would then could then be published in a subsequent meeting, if that's okay with you. Okay, great. Thank you so much for providing us with what you did. It's very helpful to have a snapshot and a good sense of sort of what's going on. It's very helpful. Thank you. So moving on now to item 5, which is budget monitoring, children's social care. So budget monitoring is a key function of overview and scrutiny, and each year the Commission reviews the in-year budgets of Children and Families Service. The aim of this item is to review in-year budget spends and identify cost pressures, review management actions to reduce any projected overspends, and progress in achieving identified cost savings for 2022-23. This item is taken alongside Children and Families Annual Report so that members can review budgets alongside policy priorities for the service. For this year's report, additional budget data has been requested on the corporate parenting service given the ongoing cost pressures in this area of service. The budget monitoring report for the Children and Family Service can be found at page 19 of the report pack. For this item, we have Sajid, who is the Head of Finance for Children and Families, and Naeem, who is the Director of Finance for Children, Families and Community Health. And we also have Diane and Jackie joining us again for another item. We've got approximately 30 to 35 minutes for this item. Again, members have all read the reports that you've kindly provided, so please can you provide a very brief summary of just the key issues, and then we'll move on to questions, please. So handing over to you.
Sure, thank you, Councillor. So the report gives the financial picture or forecast at the midpoint of the financial year. So overall for Children's and Family Services, we're projecting an overspend after the use of reserves of 1.7 million at the end of September. And page 21 of the agenda pack gives a breakdown of the largest variances, namely 1.3 million within corporate parenting, looked after children and leaving care placements, and it's largely driven by the number of placements and linked to complexity, which tend to be more expensive packages, as well as commissioning. There are some staffing cost pressures linked to additional posts and agency staff usage. There's more detail on corporate parenting placements later on in the report. Disabled Children's Services are also forecasting an overspend of 0.2 million after the use of reserves. And this is also linked to demand for placements, including short breaks and access and management. And MASH, again, is forecasting an overspend of 0.3 million, primarily related to increased staffing costs for maternity cover and agency staff usage and high costs. There's a full breakdown of the overall position for Children's and Family Services on page 22 of the pack. There's also an in-depth look at placement costs for corporate parenting, for looked after children leaving care and unaccompanied asylum seeking children from page 22 of the pack. And again, the report also highlights the savings target achievement on page 24, and also our management actions, some of our cost reduction measures that we're taking to limit our overspend, including looking at some of our higher cost placements and looking at the number of residential placements that we have.
Thank you very much. I'm going to kick us off actually with a question that's somewhat connected to what we were just speaking about in terms of foster care placements. Given the increased use of in-house foster carers, or I suppose our intended increased use and increased recruitment of foster carers, and given that this is a key priority for us, the Commission notes that the budget for in-house foster carer team has not changed since 2021-22 to the current year, and that it's remained static at 2.4 million. In this context, does the current budget for in-house foster carer team fully reflect the priority for this service, given that the in-house fostering team is now supporting more placements than last year and supporting more in-house foster carers, while providing the same budget to support a higher number of placements and an increased pool of in-house foster carers dilute the local offer to in-house foster carers? And sorry, just another connected sort of question is, given the need to extend support to help retain in-house foster carers such as the Mockingbird project, of which there are just 3 constellations. I'm not sure who might be best placed to answer that one. Looks like it's you, Diane.
So in answer to the first bit about the foster carers, what's interesting to note, now and during the pandemic, our in-house foster care rate has increased. So we haven't seen a drop off. Foster carers are still wanting to be foster carers in Hackney, which I really, really think is a good thing and something to be celebrated. So absolutely looking at whether the team is sufficient enough to kind of, in terms of the increase, because what we know, research says, in terms of being able to manage foster carers, new foster carers coming in, and then having that longevity in terms of wanting to stay with us, they need consistency. So they need the staffing behind that. So absolutely looking at what that could look like potentially in terms of recruiting or extending our team currently. I've got my corporate parenting colleagues who would welcome possibly increasing that, because the influx of foster carer recruitment is really good in Hackney. It's really a good news story for us in relation to that.
Very much, and this is perhaps connected, sorry, but also about the independent fostering agencies. I'm just wondering, given that there isn't a relationship between in-house foster carers and independent fostering agencies, or our use of, to what degree can projected budget underspend for independent fostering agencies be used specifically to offset in-house foster carer budgets?
I'll take that one. Yeah, essentially it is used in that way. So I think your point, Chair, about the use of the budget and how we're allocating it, what we'll do as part of budget setting for 23-24 is take stock of that and liaise with the service, so Diane and Jackie, to allocate the budget accordingly, essentially. But what we'll try and do is set a budget that focuses. So I guess the focus is we'd want to have more people, more children in an in-house setting. So we would reflect the budget and probably put the pressure into IFAs, which is where we want to see it going forward, essentially. I suppose in an ideal world, we'd be able to fund all of these and recognise the kind of increased trajectory that might happen in future years. But unfortunately, the funding isn't sufficient to allow us to do that.
Can I bring in any other members of the Commission, please? Got Salma and then Councillor Selman first, please.
My question is with regards to, on page 25, you make reference to young people accessing housing benefits. We're just wondering if that is young people moving on from supported housing, or are those young people who are already accessing supported housing and accessing housing benefit? We're just a bit confused about what that means. Can you just clarify?
Councillor Selman, briefly, sorry.
Yeah, I'll be quick. It was just coming back to the question about residential placements, and there's the reference in there about having the target of a reduction of 5 residential placements, which I think is an aspirations one we'd obviously support as a commission, but it'd be good to get a bit more of an understanding about how we plan to achieve that reduction, and where we're instead, where we would envisage young people being placed instead, and how we're planning on, yeah, meeting that target.
So in answer to the other question in terms of housing benefit, absolutely, it is that cohort of children that are stepping out and moving into accommodation in their own right. So we've got a particular worker who actually goes out and meets young people, helps them complete the benefit form, gets the ball rolling in relation to that. That has really increased because we've got one identified worker who's actually doing that piece of work. I think at the last count, I can't remember what that was. I think it was in its 70% of children who should be claiming the benefits are claiming the right care leavers that are claiming the benefits are claiming those now. In terms of those high cost placements, how are we doing that? We are, gosh, my head of services really robustly looking at those high cost placements. Not only, it's not just about moving children out, because if it's the right placement for a child, it's the right placement for a child, but it's about, can we reduce the costs? What is the need of those children now? And I think that's something that we need to strengthen in terms of, we're placing children in these high cost placements, 2-to-1, 3-to-1 support. Is that still needed in 8 weeks time, 6 weeks time, 6 months time? So that for me is getting much better in terms of having that rigorous focus on, the need, the cost was absolutely appropriate at the time, but can we look at reducing that? And then when children are moving, they're moving from those high cost placements either into foster carers or looking at special guardians, etc. So they're kind of stepping down from those high cost placements, or they're going into other low cost placements potentially.
Can I comment on that as well? So yeah, I'll probably just echo everything that Diane said. In terms of the forensic analysis of those residential placements, we do a kind of a lessons learned piece as well around those children. So trying to understand, I suppose, as we develop future service provision, why they've got into those placements and when they are able to step down, so we can identify key. I suppose the holy grail in terms of where we're trying to get to is where we're trying to bring together finance, performance and service information to really support our intelligence really in the area, especially around residential placements that are so high cost.
Councillor Solomon, did you?
That, and also some of the conversations we were having about like the challenges around fostering. So are we confident there's enough capacity then when we are stepping people down to step for the stuff to be there at the other end, if that makes sense? Sorry, that was a really badly phrased thing. And I guess it's just, what are the safeguards that are in place for making sure that decisions are being taken genuinely in the best interest of the child and not just from the sort of pressures of finance?
So are we confident? Yes. I make those decisions are ratified by me, and I'm not going to move a child unless it's in the child's best interest. So it's not just about cost; it's about need for me. So I'm confident we do have the right safeguarding in place in terms of making sure that's the best decision for that particular child. And for me, it needs to be. But also, there's that IRO oversight as well. And I've got social workers who potentially working with children 2-3 years, and they've got those really trusted relationships, and they think it's the best decision for children as well, potentially, to be stepping down or moving to different types of provision and resources.
I suppose what would be helpful for us going forward is that it's really clear. I think we're all in agreement that we would like to see our use of the residential units decrease, particularly if some young people are only in residential settings, sometimes outside of London, because there aren't enough foster carers. It's great to see that we have those ambitions, but I suppose the worry is that we're still seeing the challenges in terms of recruiting foster carers, or reliance or over-reliance perhaps on independent fostering agencies. So I suppose we're thinking, how do we think that that's going to be remedied? We've been speaking about foster carers. We did a review on this a number of years ago now, before I was the chair of Scrutiny, and revisited that same topic again just a matter of months ago. And we can still see that challenge, particularly with the housing crisis, is really quite marked. So that's the concern, I think, is that the ambition is appreciated, but it's just, we're just a bit worried about where those young people are going to go if they've ended up in residential settings because there hasn't, been enough. I wanted to ask a question. I'll bring other members of the Commission in again. I'm just curious on that point about housing benefit, because we've made quite considerable savings there. I'm just curious, are we making the savings because they're moving into settings or into accommodation where they're able to claim housing benefit? What are we benefiting from? Is it them accessing housing benefit? Because were they in supported accommodation and not claiming housing benefit? That was the issue? Okay. Just wanted some clarity on that. I've got some nods for the purposes of those of you at home viewing on the live stream in response to that question. So handing over to Councillor Charlton. Do I have any other members of the Commission? Councillor Ross. Okay.
Thank you, Chair. There are a few not insignificant underspends, and I just wondered why money had been fired into things like clinical services, only to increase the underspend. And, particularly in relation to clinical services, that's quite a large sum that is being underspent. So am I reading that correctly? So I just wondered what, what that underspend was, and whether those budgets, there's 4 of them that sort of like 3 that are a concern, I would say. Whether those budgets are vulnerable for cost cutting in the future, and why? I mean, are we talking about vacancies within the clinical budget, and where has the impact of that been felt? Just a bit more expansion of explanation for those.
Thank you, Councillor Charlton. I'll just bring in Councillor Ross, please.
Thank you. I've got a follow up to that as well, if you don't mind, because my thoughts are around that if you're considering that that's the underspend in terms of clinical services, have you thought about any countermeasures in case actually you identify that those clinical services are needed? And and if you haven't, what I'm worried about is that there could be an impact on provision for local families and children. So that was connected to Councillor Troughton's question, but I also wanted to ask about the early help review, and that was designed to reduce costs, but the report notes that the savings haven't been fully achieved. So I just want to know if you could just explain how much savings have been achieved by that review. Thank you.
So just to talk about the clinical services underspend, the reason for that at this stage of the financial year is actually because we've secured additional funding from NEL-CCG towards health costs essentially within the service. So that accounts for the underspend. In terms of the overall underspend and the comment about varying budgets, that's something that we normally look at on an annual basis, but essentially all of the children's budget, I suppose you could think of as being ring fenced during the year. So there aren't plans to reduce the budget and remove some of it and take it to another part of the service. So any underspends that occur in one aspect of the service within the wider service go towards the essential bottom line. So whatever the overspend is. So, but normally as part of budget setting for 23-24, which is what we're currently undertaking, we do that review. So we'll sit down with services to understand demand trajectories. If underspends or overspends are likely to occur in future years, then we'll recognise that in the budgets essentially. Do you want to take that in? So the other point was on. So I think it was on the delay of delivery. I think it was linked to prospects, wasn't it? So I think there's been some delay in delivery of the early help savings. So essentially, I think we're still working them through about how they're going to be delivered on a recurrent basis. But all of the changes essentially are factored into the forecast at this stage. So the under delivery is factored into the forecast at this stage.
Yes, sorry, just to be clear, that the early help savings that we haven't made is linked to some contractual, some commission stuff that we are working through.
So to some extent, contributing further towards the pressures that we're experiencing, the fact that we've not managed to make the savings that we'd anticipated. Yeah, and that's being felt across the piece in terms of children's social care, because it.
Yeah, that will contribute to the overall overspend at this stage, but I think we're confident we'll be able to work them through.
Do I have any other questions from the Commission? Councillor Gordon, please.
Thank you, Chair. Just focusing on the, I mean, obviously, the table respects looked after children. I mean, there's obviously, it's very sort of interesting, I think, really to sort of see the sort of different per head spend, I think, in relation to different types of care. And we've obviously had some discussion about that earlier this evening. I mean, it's, if I've got it right, it's a very startling figure in relation to each individual child is around 185,000 for residential care. So, I mean, that's obviously, you know, as we all understand, is a very significant pressure, but there are actually quite significant spends on other types of care. You know, as we've touched on in relation to agency carers, it's around looks like around 66,000 in relation to those children. So that's also a lot of money. But I did want to focus as well, actually, on the spend in relation to the semi-independent care, both for under 18s and also for sort of care leavers, because as you know, we did a piece of work with Living on Hackney in relation to that offer the end of last term, beginning of this term. And I mean, I think our conclusion really was that there was quite a variable offer in terms of this semi-independent accommodation, and we're actually spending a lot of money. So it would be really good to hear about what we're looking at in terms of service improvement. There is an overspend on that already, but in terms of service improvement in both those areas, both for under 18s and over 18s. And if I may, I've just got a quick unrelated question. I notice on the summary table 1, there's appears to be no spend in relation to the teaching partnership, and particularly in relation to contextual safeguarding. So it'd be good to hear an explanation for that. Thank you.
The teaching partnership is DFE, so that money comes directly from the DFE, so directly funded through them. Your question in relation to the supported contextual safeguarding, that was funded DFE as well, and that's now funded by me, because that money ended, so it's still a service we commission. It's still really important in terms of our just kind of mitigating against our serious youth crime in Hackney. Hopefully your other question in terms of this semi-independent new regulations coming in, you know, Ofsted led, just in terms of the registers of unregulated accommodation providers for our 16 and 17-year-olds in care. So we have to, it's going to have an impact on us in terms of how we deliver our services going forward, really. So that's probably why, in terms of those figures, because we absolutely have to consider that regulation and how that impacts on what we do for our care leavers on those that 16 to 17-year-olds.
Yeah. Yeah, I mean, can you tell us a little bit more about what work you're doing in relation to those services and, you know, in relation to the quality of the service, but also in relation to the spend? Thank you.
So we're preparing. Sorry. Yeah, so we're preparing for regulation, because we're gonna have to be clear about what that means for us and what that means for our young people in terms of just that way forward, in terms of that pathway for our 16 to 17-year-olds. So it's new, it's coming in, it's, you know, all our providers need to be cited on it. I think they're getting 6 months until implementation. But also they're very clear this is the new pathway in terms of our 16 to 17-year-old providers.
Just to be clear, so the semi-independent sector is going to be subject of Ofsted registration and regulation from April 2023. So they're going to start piloting their framework, and they're going to begin in earnest their inspections from 2024. So we welcome the regulation of that part of the sector, and we are working with providers to support them to get ready for that. But clearly, any young person, a child we place in semi-independent accommodation, we absolutely make sure that they have the support in place to make sure that they're ready for that. We have a number of young people who, you know, we recognise could not manage in semi-independent accommodation, and they're in either foster care with family and friends or in residential placement. But we absolutely welcome Ofsted stepping into the space.
I'm wondering though whether the Ofsted stepping into this space is going to explore, I suppose, what we were looking into when we did this piece of work, looking at care leavers quite specifically, because I think that the thing that was most alarming for us was the variation in terms of cost, and it wasn't always apparent to us. That wasn't reflected for us in terms of the service or that was seen to be provided. In fact, it was the complete opposite from what we'd experienced, that the placements that were cheaper seemed to be better. And, you know, and we were, quite frankly, there were some placements that we couldn't believe that we were spending as much money as we were for young people to be placed in, you know, but I appreciate that's all that we have on offer. But is there anything more that we can do to try and shape that and try to influence that market at all? And so in relation to the cost, quite specifically, and our commissioning of these services.
Sorry, Chair, but I think in an ideal world, it would be nice to hear about the availability of capital expenditure for this, and, you know, more imaginative solutions like self-build. I mean, in particular, if this is the direction of travel with Ofsted for young people, and it's clear that you both welcome that, but just it's so I know you're not going to be able to pull that out of the hat today, but I think it would be good, you know, I think as a future aspiration. I can see that, you know, purpose built, whether it would be much better than what we currently saw on offer.
I don't think I disagree with you a bit about that. What we're really mindful of is that, you know, that would be a big capital investment programme, and it is something that we'd happily explore because, you know, if we could have that kind of accommodation, it would be an asset. But we are very, very mindful of the financial situation we're in as a council, but conversations about that kind of capital investment are happening across London, and certainly within the council, we'll be having conversations about possibilities.
But I mean, it surely has to be an argument that could also be an invest to save, you know, strategy. So I mean, looking at the figures of the alternatives. Thank you. Yeah.
We were hearing of placements, I think, that were costing us about 25,000 a year. Supported accommodation, you know, and the thing that struck me is that on average we're talking about having young people there for 3 years. That's a mortgage. That's a mortgage. That's a deposit for a flat in Hackney, you know, even on the private markets. And yeah, it just, and this is where I think for us we keep thinking about the siloed approach and thinking, and it just feels quite frustrating that we're throwing good money, you know, after bad to some extent, because it's not particularly helping us. So yeah, I don't know, Naeem, if you have any suggestions on that front, because it
Yeah, no,
You've got any capital in your back pocket?
yeah. I always see my other suit jacket, unfortunately. I suppose in an ideal world, the real challenge is around affordability. But I think Jackie's point's completely right. These are the conversations that we're starting to have. We're thinking much more strategic around the kind of wider ambitions for children as they approach adulthood. And in that space, I think we are going to explore in more detail opportunities around capital investment. But the real challenge is the affordability of some of these schemes, given cost of living, Brexit, all the other issues that we're implicitly aware of. But yeah, I think we need to do more in the space to explore whether it's feasible or not. I couldn't comment on at this stage, but it's certainly something that collectively we'll be exploring with the service.
I have to say, we've been saying this for a while. I've been in this chair for a while, and we've been talking even about building residential settings, you know, and it just feels as though
Yeah, I would agree.
We were having this conversation 3-4 years ago, and we're arguably, you weren't here. No, we were having this conversation as a commission, and not necessarily even with you, Naeem.
Yeah.
But it's just interesting to see that now here we are, and actually things are even more strained than they were then. And we're talking about how we might be able to make things a bit easier for ourselves in the future, although also appreciating the limitations and the fact that we may not be able to achieve that.
Yeah, and I think the real benefits recently that I've seen are some of these issues are being flagged at a pan-London level. So Jackie and Diane are privy to groups that are discussing this at a pan-London level, which gives us more opportunity and almost more buying power. So where we've really benefited are some of the residential placements where we've got pan-London consortium arrangements, and obviously that started to be explored in the secure space. But there's a lot more that we can do with those arrangements, to be honest. But I think we have to think more broadly than just outside Hackney, because the real challenge of trying to build anything and the risk to a local authority individually, actually, if we can share that, even at an NEL level possibly, that gives us a more scope, and it kind of spreads the risks. But these are all the things certainly that we need to be exploring in more detail.
Sounds like a great idea, to be honest with you, to have something that's pan-London, because the challenge is pan-London, and also so many of our young people can't stay in Hackney, don't want to stay in Hackney, so it can't just be something that we're looking at. Do members of the Commission have any other questions? If not, I may ask a question about the vacancy rate savings, if possible. So vacancy rate savings have been introduced across council departments to assist in stemming overall budget shortfalls in the general fund. At page 24, the report notes that there is a target of 900,000 saving to children and families. How much of this is forecast to be achieved, and how much will need to be mitigated? And linked to that, the vacancy rate saving of 900,000 is a significant sum. Has there been any assessment as to what impact that this has had on service provision, particularly as this includes a number of key posts, for example, the Leaving Care Welfare Benefits Officer, as specified at page 25.
So in terms of the vacancy factor, just for wider context, the vacancy factor that was applied across the entire council was a 3.5% levy, essentially, is probably how you'd see it. So across children and families, that accounted for approximately 900,000. And the rationale was that we would hope, as staff leave in non-frontline aspects of the service, they aren't recruited, or there's inevitably a bit of a delay while we're recruiting, that saving during that period would go towards this 900k. But there's also a wider exploration around budgets and non-pay elements, and where we can explore additional income from partners essentially. So this is the exercise that's been done. It's not been without challenge. I'm sure Jackie and Diane will both share their thoughts on that. But we're confident at this stage that it will be managed. But just to say, it's not been done solely through vacancy rate. So I suppose through this approach, what we've not done and what I've not suggested to Diane and Jackie at any point is you don't recruit to a post that you need to recruit to. This is almost through natural churn in the system that we've been able to identify, the 3.5%. And we're confident at this stage that it will be delivered, but that could change. It's a bit of a moving picture, so to speak. So it will just be something that we continue to work through with heads of service. But it's not done in isolation. No conversation with a head of service or a budget holder is don't recruit to that because you've got to deliver the vacancy factor. It's about ensuring that services are kept safe and there's sufficient capacity especially from a workforce perspective, to work things through.
Just to confirm, you are confident that that target will be met?
Yeah, I'm as confident as I can be at this stage. You know, there's always challenges, and we've talked about some of the challenges around recruitment. Those challenges aren't just on frontline services; they're across the entire sector, if I'm honest. So trying to get people through the door when staff leave is a real challenge, and during those periods, we're confident to the degree that we can be that the target will be met.
Thank you very much. And did you want to come in at all, Jackie or Diane, in terms of the impact that this has had on service provision?
So it's not unusual for councils to have a vacancy factor as part of their savings plan, and I've worked in authorities where it's been higher than 3.5%. Some authorities don't apply it to frontline services, but Hackney does apply it to frontline services. I would say that in terms of my priority, Diane's priority is to run a safe service. So if we thought this was jeopardising the safety of children, we would be very outspoken about this. And I'm confident that finance colleagues would be listening to us. The safety of children is our priority. We're not going to recruit to a statutory post. I think, as Naheem says, we do have, so for example, when a social worker leaves, we can't have a vacancy. We have to get someone in immediately because that's, we need to have those posts filled at all times. But in most organisations, you have some slippage when someone leaves and there's a recruitment drag. So that is generally how we meet this particular element of the vacancy factor through non-essential, non-statutory posts.
Thank you very much. Any other questions from the Commission? If not, I think we're going to move on. So thank you very much for everybody who's contributed and for the report. It's really very helpful. I don't say this is something that I enjoy. It's not something that I enjoy, but I think it really does help for us to really understand the pressures, the cost pressures that are driving some of the decisions, or I suppose the cost pressures that are underpinning or informing many of the decisions that are having to be made about service delivery. And yeah, just recognising the ongoing challenges and the complexity of the sort of landscape that we find ourselves in now. But I would like to say that it would be great if we do hear about some investor save or some capital or some greater partnership with our colleagues in housing to think about how we can, something we picked up in that piece of work is that actually in our builds as a council, young people are not really considered very much in that. We're thinking about building for families but not so much studio flats and what might be necessary for our care leavers. So it would be great to see some more synergy between the services, especially where we think investor save might actually achieve some cost savings for us in children's social care. So thank you all for that. And now moving on to item 6, which is the SEND strategy. So Hackney Education has developed a new SEND strategy for the period 2022 to 2025. which was approved by Cabinet on November 21st, 2022. Alongside other stakeholders, the Commission has in part contributed to the development of this strategy, particularly in relation to its work on post-16 SEND provision. The objectives for the Commission for this item is to note the contents and the underpinning principles of the SEND strategy and to question officers on their plans to deliver key objectives detailed within it. The Commission understands that an action plan is being developed with partners to support the delivery of the key aims of the SEND strategy, and which itself is being presented to this Commission in February 2023. It is envisaged that through the ongoing scrutiny of the SEND action plan, the Commission will retain oversight of the delivery of key service developments and improvements for SEND services. The SEND strategy is at page 33 of the report pack, and for this item we have Jo Wilson, Head of SEND, and Paul Senior, the Director of Education and Inclusion. We have 35 to 40 minutes for this item, so can I ask officers, again, we've read the packs, please be brief. You've done a great job so far, I have to say, so it's a bit of pressure on now for Jo and Paul. Handing over to Jo and Paul, and then to the Commission for questions, please.
Thank you, Chair. Chair, as you've said in introducing the work of the SEND strategy, it's the local area partnership approach, and the local area partnership consists of statutory partners across education, health and care, and it sets out the key priorities and the strategic aims and the ambition of local partners in the SEND space, with a view to working together to improving the outcomes for local children and young people with SEND. So it really is a forward look. It's looking at, based on local need, based on local ambition, and based on local priorities, what the ambitions and the key priorities and aims will be for the work of the partnership. So this sets out a framework of ambitions in the strategic priorities covered. And as you've rightly said, Chair, the implementation plan will be coming forwards to this Commission in February, where it will set out the specific actions, the milestones, the timescales, the accountabilities to help progress those actions. So the strategy just set out an overview of the priorities and the key themes underneath those priorities to drive those agendas. Thank you.
I think Councillor Woodley might want to say something else.
Sure.
Okay.
Oh, it's fine. I'm happy to come in on the questions, but it is quite nice seeing Paul here because I feel like this strategy has been in the ether for quite some time. So I met Paul in his first kind of spin around Hackney at the beginning of the pandemic, and this strategy is very much trying to draw learnings out of the pandemic as we come out the other side. But we've certainly been living with it for some time, trying to put the core principles within it into the action plan. You know, Joe McLeod, who's off screen at the moment, has kind of contributed brilliantly through our SEND Partnership Board as well. So hopefully the priorities are really familiar to those sort of longer standing members of this Commission in terms of outstanding provision, in terms of having that earlier response. We know that that's been dragging and that that's really important to address. In terms of preparing for adulthood, I remember a really good Scrutiny Commission meeting here where we were meeting post-16 providers, and now we see the pavilion opened and progress in that regard. And the big one, as always, joining up our services, and I think there's a real commitment across the council to really act upon that. But I'm delaying you, so I'll stop there.
Thank you very much. Members of the Commission, do we have any questions? No? Councillor Suso-Runga and Councillor Ford, please.
Thank you, Chair. Thank you for that. I just wanted to concentrate a little bit on the strategy, in particular priority 4. What are or what were the barriers to jointly commissioned services, and how will the strategy overcome that? And then supplementary to that, I would like to hear a little bit more detail about the joint agency plan and the progress of the plan in 2023. Thank you.
Take another one, or shall I? Councillor Gordon, did you want to come in, or?
I mean, this is no doubt something we'll hear more about at the action plan stage, but I mean, as we're all aware on this Commission and more generally, there's a significant deficit in terms of SEND spending. I mean, it would be good to know really how that sort of fits into the picture. how you expect the sort of financial uncertainty to sort of impact the action plan around this strategy. And also in relation to and I know there's capital expenditure in the offing, which is very welcome. I just really wanted just some reassurance about how certain that is to, certain that's going to be available and we're going to be able to spend it as we want to. Thank you.
Paul, did you want to come in?
Thank you. With regards to SEND commissioning, as a local area and across statutory partners, across education, health and care, there's a finite pot. And lots of the, if you like, the resources are tied up in delivery. Lots of the resources are going to schools, they're going to specialist services, they're going to certain areas. So as a local area, as a local set of partners, we have to make decisions. What are our strategic intentions? What's our priorities? So when you ask the question, what are the barriers? Well, the barriers very much are the pot is the pot. If we are to make decisions on doing things differently, we have to decide what we're going to stop doing as a result as well. Investment in our schools and settings is important. Investment in our special schools is crucial because our special schools are the cornerstone, if you like, of our local offer with regards to SEND, but also investment in our mainstream schools to help our mainstream schools be enabled and empowered to work with children, young people with SEND. A big pressure in this part of the world is the rising demand and need. We've looked at since 2014, commencement of the SEND reforms, the demand for specialist provision has increased 65%. 65%. So as a local area, we have had to find significantly more special school places. And that's had a knock-on effect. And that's had an effect on the ability of our mainstream schools to be able to provide provision in a timely manner in response to complex needs of children and young people with SEND. We've seen last year the demand for education, health and care plans was at 5% of the local child population. This year it's at 5.3%. 2020, it was at 4.4%. I'm not trying to bamboozle folk with maths, but you can do the maths. The numbers are going up. The demand, the complexity and need is increasing. And that's just on the education side of the system. That has a knock-on effect for our colleagues in children's social care. That has a knock-on effect for our colleagues in adult social care. And that has a knock-on effect in our colleagues in health as well. So what I'm trying to say is a local system, there isn't a single budget. It is a case of coming together, combining our priorities, pooling our resources, and identifying what are our key priorities and what is it we're going to stop doing. Because of the increasing demand and complexity you need. But there's also a statutory element here. Certain things we must, as opposed to should, or as opposed to have an option on. So we have to make those decisions around what the priorities are and how we execute and how we invest around those resources. So commissioning, absolutely, coming together. There are plans and processes in place, and there's an ambition to even strengthen that further as a local area going forwards. The question was asked about significant deficit in the SEND space and the financial uncertainties. Absolutely. I'm sure colleagues have cited on the work of the ambition that's set out from the Department for Education in the SEND and Alternative Provision Green Paper, which is working its way through the political system at the moment with a view to being ratified in 2023. So those ambitions will be talking about more investment in local areas, to support local areas to be better positioned to invest in schools, to passport more of that funding to schools, because dare I say, schools are very much at the front end of this. It's important, whether it be mainstream schools, building inclusion and capacity and capability, or our special schools in having, again, the capacity to be able to be responsive to needs. To reduce the need for children and young people with additional needs having to go out of borough to access the non-maintained sector, which is a significant pressure on the system as well. So we do have significant challenges in this space. And when you look on a national scale, the funding gap is 2.5 billion and rising in the SEND space across 151 local areas. So it's not Hackney alone that are seeing their numbers going up. It's not Hackney alone that's seeing the demand and the complexity and need increase significantly. But obviously we are working with our partners in neighbouring local authorities as well to compare, to contrast, to share practice, and also pool resources and opportunities when they do arise. So hopefully that gives you a feel for what we will seek to do in the budget space and actually to manage resources, but it's a local area partnership across statutory partners, across education, health and care, who have to be responsive to need, not just the local authority.
Could I just say thank you to Paul, and I promise that next time when I ask you a question, I will have a cushion so that I'm a little bit taller, that you don't have to strain. Because I sense a pattern here. Every time I ask a question, it's you that has to answer. So thank you for your patience.
Thank you very much. Do we have any other questions from the Commission? Yes.
But yeah, there was this question about JAP, which is our joint agency panel. So that's a panel where we look at children with really complex needs coming through the system with colleagues from education, health and care, and look at the best type of placement for them. We'll also look at funding splits from different agencies. So we might be looking, if a child has specific health needs, health might contribute some of the funding. It's a relatively new process in Hackney. So the joint agency panel, we first started about a year ago, and we're working our way through that at the moment. So we will be evaluating how that's going in the coming months.
Thank you very much. I've got Sama and then I've got Councillor Gordon, please.
Hi, my question is all about parent involvement and support. How will the new SEND strategy ensure that the voice of parents is heard and that they are meaningfully engaged and involved in key decisions about their child? And will there be any future provision for parent advocacy given the complexity of the SEND landscape? And just to give you an example, where I work, we do have a parent forum. I'm just wondering how much at the moment those parent forums are informing future strategies. That's the building.
I was going to ask a similar question about parental engagement, which Selma's really helpfully asked, but I'd also like to ask about SEND support. It says on page 18 of the strategy that families and schools tell us that SEND support in schools is a big area of need. It's not currently being addressed. I mean, obviously, the vast majority of our children with SEND are in SEND support packages. There's, you know, there isn't a statutory, limited statutory framework around those, and obviously limited rights and, you know, for parents to have information in relation to the plans. So I just really want reassurances that when the action plan is also going to address in terms of parental engagement, parents with children with SEND support, and also address issues in relation to communications, you know, and transparency in relation to the, you know, to the vast majority of our children with SEND. I mean, obviously, our high needs children will be rightly placed on EHCPs, but I think it's very important the strategy doesn't forget, you know, or marginalise that, you know, that cohort of children who are on SEND support, who've got a variety of needs. So really looking for a comprehensive offer for those children. Thank you.
Joe, I will give you a chance, honestly. Parental engagement is crucial, absolutely. The role of our parents and carers have played a role in shaping and designing our plans and ambitions there. We have a number of local area parent engagement groups that we worked with, but we recognise that our Parent Carer Forum, there's a programme of work ongoing to rebuild the work of our local area parent carer forum. We are working with Contact, who are the national organisation commissioned by the Department for Education, to work with parent carer forums across 151 local areas. The intention is that we will hopefully, by the beginning of the new year, have a new parent carer forum in place that will be able to systematically bring that challenge, that support, and that capacity to ensure that parents' voices is consistently represented as we shape and design our work going forwards. So no denying there's been some challenges with the local area with regards to previous engagement with Parent Carer Forum, and as a result, some tough decisions have had to be made, and conversations with the Department for Education and Contact, a national organisation, with regards to coming to shaping and designing a Parent Carer Forum that is further responsive to need. But that doesn't mean we don't engage with our schools. In conversations with our schools, and our school leaders are telling us things about SEND and picking up the voice of parents as much as possible. So the simple answer to your simple question is the voice of our parents and carers is absolutely critical to help us shape and design our services, our processes, our SEND strategy, as is the voice of our children and young people as well. We believe in the principle of co-production. It's essential. Absolutely, this shouldn't be just written by professionals. But in addition to the work of this forum, which has played an invaluable role in helping shape and design the strategy as we have it. So thank you for this forum, because it clearly is a better product as a result of the experience of having gone through this forum. The roles of our parents and carers and their voices are absolutely crucial. But in the new year, we would hope to be in a position to be able to launch our new parent carer forum if the progress that we're making with Contact and with the Department for Education and ongoing dialogue with parent groups reaches its natural conclusion. With regards to SEND packages, you asked the question, how can we ensure that children and young people at SEND support are getting place or getting access to education, health and care plans? I think I said earlier, this local authority actually is incredibly generous when it comes to the issuing of education, health and care plans. The national average is at 4.2%. The Pan-London average is at 4.4%. Hackney is at 5.3%. So that's about actually issuing plans in response to needs, not the financial element. So I can assure you, based on the need, based on the evidence, if children and young people are reaching those thresholds, this local area does issue plans in response to needs. So, and again, the point about the voice of our parents is absolutely crucial. And parents are engaged as part of the statutory process to ensure their views feed into the development and the shaping and designing of our education, health and care plans. Joe, is there anything you'd like to add any further?
Thanks, Paul. Priority 2 is all about our earlier response for children with special needs. And what we decided to do when thinking about the strategy, but also thinking about how local authority services work, was go back to basics. So we decided that actually what we needed to do was implement a graduated approach for SEND, which we've spoken at this forum about before. We also realised that we needed our staff to be working around schools. So we've developed a team around the school offer, which means that various professionals such as psychologists, speech and language therapists, school nurses are working around clusters of schools, and every school is having what we're calling a multi-agency planning meeting every term. That meeting is designed to look at all children on SEND support. So that's how we're actually now being able to monitor them and think about their progress. But what we're also wanting to do is be slightly more adventurous than that and actually think about planning at school level which system we think a child needs to go through. So do they need an EHC assessment and plan, or are they making progress at SEND support, or do they need additional funding or resources? That's early days, and that's a system that started this September. So by the end of the summer term, we should have some really good data about how those children at SEND support are doing in their individual school level.
That's, I mean, that is very helpful and reassuring, because I mean, obviously one of the, you know, it's sort of self-evident to me anyway, that if there is a, you know, comprehensive offer, including communication with parents for children on SEND support, that is likely to, you know, as well as improving outcomes for those children, make it less crucial for parents to feel that they have to apply for an EHCP. So I think that is really helpful to hear, because in my experience it didn't really happen at that level before. So I don't know, Chair, whether I can ask a couple of other questions, or I don't know.
Sorry, I wanted to bring in Jo, because I've noticed that she's had her hand up for a while, but I will come back to you, Councillor Gordon. But just to include something, Councillor Binny Lubbock is not here tonight, but had mentioned something on that point about parental engagement, that Barnet, sorry, he'd emailed in some questions, that he's noted that Barnet Parent Carer Forum seems really active and a really key partner to the council. And I, interestingly enough, attended some training earlier on this week by Camden's Family Advisory Board, who have been doing some really interesting stuff, including, this isn't so much related to SEND, but in relation to peer parental advocacy in terms of children's social care. But they are quite, it just feels like a broader offer than what we've had to date in terms of HIP, in terms of being able to span across education, but also children's social care and health, and to get a collective parent, not just parents, but family voice on board. So foster carers, our experience is that we've got loads of pockets of different groups who've got a lot to say that's really valuable, but I wonder whether we could look to these models to see whether they're, given that we're thinking about rebuilding our parent carer forum, if there is any scope for us to do something that's a bit broader and a bit cross-cutting, especially as you'll all be sitting next to each other now in the same space. So surely that might be, but I would urge you to have a look at the Barnet and the Camden model. I think Camden's been doing it since 2014 now, and I think it's been peer reviewed, and yes, it would be quite good to have a look at that. Paul, did you want to come in?
Thank you, Councillor. And one of the benefits of myself being an interim, I was also an interim director in Barnet in 2014, an interim director in Camden in 2015. So I'm very familiar with the benefits and the strengths of those models. So we do compare and contrast as we redesign. And you're absolutely right. It's very important that we look out the window where there's good practice with a view to learning. And we've been doing this since I've been here, and we were doing it before I came here under Jackie's stewardship and Diane's as well, in terms of having conversations with partner local areas where there are good practice, where what works. Rest assured, our colleagues across education, children and families are obsessed with looking at good practice and learning from elsewhere, and we're plugged into our regional and sub-regional groups. So it's an ongoing, every day's a school day, Chair. Every day's a school day and an opportunity to learn. But absolutely, you've just taken away the excuse that you're in separate buildings. We can actually talk to each other and look at more synergies. So absolutely, Chair. Thank you.
Sam, was your question connected?
Yeah, so just a little bit more about parental engagement. I just want to point out that the community sector actually do a lot of work with front house services, with parent engagement, often being the first point of contact, especially when there's language barriers. Their fears around culture, around values, and just to make sure that this sector is also represented in this overall strategy. Quite often, we have youth workers who have to ask to attend meetings with education, so just making sure that those professionals are included in any ongoing sort of work as well.
They will be an invaluable part of this process. The community sector is a rich resource locally. If it's something that we may have inadvertently missed as part of our processes in shaping and designing strategy, rest assured we'll be making sure that not only having a voice at our partnership for SEND and other mechanisms going forward, their voice will be represented as part of the process. So thank you for flagging that, Councillor.
Thank you. I'll now bring in Joe and then Councillor Gordon, please.
Thank you. I also just wanted to reiterate everything that everyone has already been saying about the importance of feedback and involvement of families, parents and carers, and I think hugely welcome increased support and investment in that and in sort of parent carer voice via a new forum. I also think that we need to be really careful to include children and young people's voices themselves in that. We've talked about parents and carers and families, and perhaps one way of doing that is through the sort of youth work. But I think we one way or another, we need to be really careful to make sure we include that directly, and also to think about how this feedback is going to be captured and reported back to the community, so it isn't just sort of held within sort of strategy meetings, so that all of that feedback is also, but it's a two-way process, and so people really feel they've not only been heard but listened to, but then their feedback has been responded to. And in particular, I think the idea of increasing support for peer parental advocacy work, it would be a really fantastic piece of work to include in all of that. I also wanted to ask a question about post-16 provision. This commission has done a whole piece of work on post-16 SEND almost 3 years ago now, and we made a number of recommendations to inform this strategy. And so my question was to try and drill down into how the SEND strategy is going to assist the delivery of post-16 options, both in terms of the volume and the range of options available, and in particular the numbers of supported internships. Thank you.
Can I bring in Councillor Gordon?
Thank you, Chair. I've got some slightly different questions. It's good, actually, I think, to see that Paul's job title is Director of Education and Inclusion. I think that obviously, sends a really, really helpful message. However, I may have missed it, but I was, I think, looking, I mean, obviously there's a lot about inclusion in this, but I was looking also for a stronger commitment in terms of anti-racism, because I think it's, the position of this commission that we need to have a comprehensive systemic anti-racist strategy, not only across education and children's services, but across all the council services. So I was looking for that in here. There is actually one particular I suppose, community ethnic group that is mentioned in relation to the Haredi community, and its commitment to work closely with the Haredi community to ensure that services and provision are put in place to meet the specific needs of the children and young people with SEND within those communities. So it'd be good to hear a bit more about that. I mean, obviously that community needs to have the same standard of provision and consultation as the rest of our community. I'm sure you're not saying it's not going to, but they are specifically mentioned. And I think really sort of coming on from those, I think my final question really was in relation to data and analytics. I mean, how much do we know in relation to our population of children with SEND, both on SEND support and in relation to EHCPs? I mean, how much do we know really about who they are, where they come from, what their sort of characteristics are, and how can we, what do we know that's driving the increase in demand? Do we know enough about that to inform our future decisions? Thank you.
Chair, is that okay? How will the work of the SEND strategy strengthen the post-16 agenda? I think the SEND strategy sets out an ambition with regards to provide a local offer that's responsive to needs. It's incumbent on us to assess the need and the pathway, young people coming through the system, and making sure that we've got a post-16 local offer that's responsive to needs, and whether that be curriculum-based, whether that be technical skills, whether that be college, whether it be sixth form provision, whether it can be work-based placements. There is an ambition through the work of the local area partnership to endeavour to find provision in response to local needs. So the SEND strategy, with the support of partners, I can't say to you it's going to be a panacea. It's an ambition. It's an ambition. As I said in my preamble earlier today, the SEND strategy is an ambition which partners here today, as well as right across the local area, across education, health and care, have played a role in shaping and designing. What I would say is that when the implementation plan comes back in February, you'll be able to get sighting on the detail with regards to how we will be seeking to progress post-16 interface in a little bit more detail. And any strategy has to be based on an assessment of need. So we look at the need. What's the pathway data tell us in terms of what's coming through the system? So I can't give you the exact solutions because I'd have the implementation plan now and I'll tell you what that would look like. But what I will say to you is that with the post-16 element and the other parts of the system, all groups, all demographics across the local area, the implementation plan will set out how we will seek to close those gaps and implement the ambition and the high-level aims that we've set out in this framework. You asked about data and analytics. Absolutely, Councillor. I think that's such a crucial part, isn't it? Because if we talk about having a strategy that's needs-led, evidence-based, outcomes-focused, it has to be underpinned by data and analytics so we can make some well-informed commissioning decisions around where we spend the resources, where we target our energy and endeavours as well, and where, unfortunately, we might have to make decisions on what we're going to stop doing because we'll focus and prioritise our resources around our greatest level of need. So data and analytics will be crucial, and we're putting together various forms of data, scorecards and all forms of data that will inform the implementation. So if it's desired by the work of this committee, then I'm more than happy to bring along SEND scorecard where we can share some of those data and analytics sets that inform our commissioning intentions, that inform our strategic decisions, and our plans of action as well. So it's absolutely crucial. The data and analytics will be the cornerstone of our implementation plan. So I've been asked some questions around implementation, and like I've said, I can give you the high-level overview that's set out in the ambition of the strategy, which partners here today have helped to shape and design. But I would ask that let's see the implementation plan, which really will drill down to the key actions to drive all parts of the ambition set out in the strategy.
Can I just come in very briefly on the point? Did you want to come in? Just to come in very briefly on the point about our anti-racist strategy. So I appreciate that collecting the data is going to be really important for that, but it feels as though we're having a bit of we're proposing to be reactive, that we're going to implement the strategy and then wait for the data to come in. I'm wondering whether Councillor Baldwin was noting that it's not present. The fact that it's not been mentioned perhaps suggests that we aren't taking a proactive approach to, we've seen in these meetings the disproportionalities around, well, some data that we'd asked for that we didn't actually quite necessarily get in the detail that we were hoping previously in relation to the breakdown of the different types of special educational needs and the young people who have these diagnoses. So I suppose it would, maybe this is a separate piece of work, but it would be helpful to have a sense of how we're setting out to explore that through this strategy.
Rest assured, Councillor, for us to get to this juncture of the SEND strategy as we have it, there are significant bodies of data that have informed that. We're not reactive. The strategy is evidence-based, it's needs-led, and it's outcomes-focused. The implementation element of the plan, which I say will come forward in February, will set out milestones, timescales, and specific actions. But the strategy you see before you has been informed by data, evidence, and need. We have things like a self-assessment, for example, which we are currently working on, which is a self-assessment of the local area's SEND, strengths, weaknesses, areas for improvement, and the demand and the need. And that's an important document that we're working on. It tells our story, and that is evidence-based and data-led. So I can absolutely assure you that it has been underpinned by data. We are not reactive, not at all.
Just to clarify, that will be in the action plan. The details of that will be in the action plan.
We're also developing our inclusion charter, which will focus on us being, as an education system, anti-racist, but also inclusive for children with SEND. So that document's going to focus on that, but it will be linked to some of the priorities in the strategy as well. So once we've got sort of those three key documents, the inclusion charter, the action plan, the SEND strategy, they should link together coherently.
Yeah, I mean, that's helpful and reassuring to know. I think it would be really, I think it would be really helpful if they were cross-referenced as well, just so that it's entirely clear what the plan is.
That would be, I think that would be helpful. That's possible. Councillor Woodley.
I just wanted to pick up on your remarks around the Haredi community or the Orthodox Jewish community, and perhaps refer back to also your concerns about the SEND deficit and where we are financially with I guess what I feel is a really important milestone, which is through our Investor Save proposal. Again, very familiar to long-serving Commission members, but maybe not so much to new ones, which is to have more provision in borough. We have been supporting a new special schools side by side, which will serve the Jewish community as well as the wider community, with an absolutely outstanding setting to match, that of the Garden and Ickborough and Stormont House. And we are also finding we've been more warmly welcomed, I think, into other settings where there is SEND need on the back of that, because they're realising that a closer relationship working with us will benefit some of those children, which is all that matters ultimately. So we're feeling very optimistic about improving those relationships. I mean, also within the early years kind of side of the work that I do, we already have a very kind of solid relationship with Lubavitch and those sort of children's centres. And as we develop the children and family hubs idea,
and that access, opening up those doors to 0 to 19-year-olds. I think there's an opportunity to also support families with SEN across all communities, including the Orthodox Jewish community that perhaps don't come to the Lubavitch, because there are so many different communities within the Orthodox Jewish community. And I also wanted to pick up on Joe's point. Oh, and sorry, just to add to that, that whilst we still have that deficit and we still have that challenge, and I'm not going to pretend that's not a daunting challenge, you know, it's moving up to something like 18 million by the end of this financial year. We have at the same time been really successful in terms of the capital funding coming in from DFE to build on the work that we're trying to do to increase the number of places we have. You know, in our manifesto, we've committed to 300 more places to send. Where we had incremental capital funding awards of around 2 million, 3 million, 4 million in the past, we've had 2 consecutive commitments of 6 million. So we now have in excess of 12 million in the pot, as it were, to put into the new provision that we're bringing forward as part of our estate strategy. And, you know, there are so many pieces of work, but that they do all connect up, and we're working together much more to ensure that they connect up as we go into the new year and sort of get to the kind of crunch decision moment for a lot of this work. And it is pretty exciting seeing some of the additional resource provision going into some of our schools, seeing the outcomes of some of the feasibility studies that we're doing, and the potential there to really transform areas of Hackney to make it more accommodating of our families and our children with needs. To pick up on Joe's point around listening to some of those children as well, you know, that's a big hobby horse of mine, and I champion it. And I hope I'm not wrong, Joe, but my understanding is that we're going to put more capacity into supporting pupil forums, and particularly around SEND Pupil Forum, because there's just been some really fantastic work. And I do want to shout about the work that Rhiannon and Ella have done, particularly around those sort of cliff edge moments around transition, bringing children together and hearing what they have to say, and their ambitions as they go on through our school system. And finally, not in this room, around supported internships, Joe, I'm really glad you mentioned that. So I work quite closely with Councillor Williams on that, on the supported internships, and got invited to an event where we were to give awards to some of our interns, many of which I can't remember the percentage, it was something like 90%. It was a really large percentage. We're going on into employment on the back of those supported internships. I mean, it was absolutely, you know, phenomenal work. And if we can get more support and scale that up, you know, we can just do more and more and more for those children and young people in Hackney. So there is a lot of ambition and a lot of pride, I think, in these small areas of work. We just want to do more of it. And every time we have a success, we can go forward and ask for more money. And that's what I feel has happened with the capital bid. Sorry, I'm kind of probably misquoting it. What is it, Joe? Capital funding and from DFE for building. Yeah, because we were able to show them, you know, the outstanding provision that we have, the outstanding settings that we have. We've now got $1 billion on top of that. And every time we do that, we can give more confidence that we will deliver on things. So I believe that's going to be the case with the supported internships as well. We're award winning for our apprenticeships. You know, we just have to kind of grab those good pieces of work and ask for more money to do more.
Thank you very much, Councillor Woodley. And interestingly, I remember going on training years ago, which I think I've raised this before, and somebody didn't necessarily in the room didn't necessarily agree. Not anybody here, but often we talk about children and families. There's an argument to say that we should just be talking about families, because children are always a part of a family, whatever that family may be, you know, whatever that family makeup might be. So it's interesting to talk about the voices of children and young people, because if we were to have something like a family advisory board, that should be a part of that. It shouldn't just be parent voices, it should be foster carers, it should be children and young people, it should be other, you know, community organisations who are supporting families, and a sort of broader take on the notion of a family. Essentially, it's that village that raises the child. Sorry to slip that one in, but you know. So I've just got a couple of final questions. Try and put a few questions together. But how are we going to measure the success of this? I appreciate that the strategy is it doesn't set out necessarily any sort of targets which might provide a measure of success. But but do we know what success would look like? For example, decreased exclusions for children with special educational needs, or more young people transferring to adult social care? What does success look like? But also, what governance structures are in place to oversee the implementation of the SEND strategy and the delivery of the action plan? And if I may just slip a final one in, I just wanted to ask about our priority 2, which is the earlier response. So if New Regent's College and the re-engagement unit are to work preventatively and support children in need earlier, how will the SEND strategy ensure that all local schools maintained and academies are equally engaged and committed to this agenda?
So in terms of tracking and measuring the outcomes of the strategy, we've got various mechanisms to do that. We've got our statutory performance, so a big one for us is delivering on our statutory duties and reviews, EHC plans, making sure we're doing the statutory work on time, thinking about parental feedback and family feedback and people feedback. So are they making good progress, good outcomes? Are they happy in their provisions? Is what we're doing making a difference? As you said, exclusion data, attendance data, so a whole raft of performance measures that we will be using. And that will be monitored very closely by our SEND Partnership Board. So that's a mechanism for reviewing our progress. I think we also say in the strategy as well that we want to set up some family groups who can work with us at certain periods of time to think about different elements of the strategy. So are we delivering it on this from a family's perspective, or do we need to rethink and do things slightly differently? We fully acknowledge that this is going to be an organic process, as special needs often is. So we'll have to revisit certain elements at various points and maybe think again, or think about doing things in a different way if they're not working.
So,
just an addendum really, the Hackney Schools Group Board now has a new chair, really fantastic member called Marisa Childs, who was very engaged in our belonging work last year and parent engagement work through the lens of race and George Floyd, and the focus now is going to be on again on race, but also on SEND. So I think we're very conscious of the disproportionate challenges against SEND and Black and global majority children and families. And I'm sort of really welcoming that sort of intersectional approach. So just to let you know that work is also happening to the side. I feel like I've spent the evening telling you everything that's happening to the side of the strategy instead of focusing on the strategy. But it is, it is nice to see all these things connecting.
and on the point about the re-engagement unit and New Regent's College.
So the first time this year, the re-engagement unit is a universal offer. So it's available to all schools in Hackney. So all schools can have a re-engagement unit worker who will work with that particular setting. Used to be a traded offer, but we've made it universal. So it reaches further. The work around New Regents is something that's in development and very much fits in with what we've been asked to do as part of the SEND review, which has been delayed. So part of the thinking there is alternative provision becoming more inward reaching into different schools and services, and that's something we're working through at the moment.
And I suppose the sense that I get is that that's our position. But how is that being received by our family of schools across the piece? Because I think what's come up in a number of different meetings that we've had on various different topics, that our engagement or the extent to which our schools are receptive to our intervention varies. So how can we ensure that this universal offer can be universally applied and received?
Yeah, it does vary, and that's actually similar to some degree for our SEND offer. So there's certain schools that won't accept our free offer, for example. They want to do things slightly differently. And that's fine to a degree, because schools are autonomous to some degree and will want to do things sometimes in their own way. But we're really focusing at the moment on our training offer. So we see that as a way of getting into most of our schools in Hackney, because we're offering really good high quality training for free for the first time. So we're hoping that's a way in. But if schools aren't taking on board what the universal offer is, we have to think about how we support them to do that.
How you support them to do that, but also I'd imagine how we talk about what you've been able to achieve with the schools that you've been able to successfully partner with, because we've been speaking quite a lot about how exclusions, are quite a big issue for parents. And I know that some of us feel that we should be a lot more transparent with parents about the exclusion rates for individual schools. But if schools are able to say we're working with the engagement unit and New Regents College and having a more sort of inward looking approach to this, and as a result we've cut our exclusions and we're able to successfully meet the needs of a greater number of young people, I'd like to think that would be something that we would be forthcoming in talking about. And I imagine it would be incredibly encouraging for parents to have that sense of assurance that their children's needs will be met, and will benefit from that sort of collaborative effort between the re-engagement unit, the PRU, and the various different schools. So yeah, I think I'm probably going to bring this item to a close now. Thank you very much. Really looking forward to seeing the action plan, especially as you mentioned, Councillor Woodley, that a lot of what you've spoken about, I anticipate will be in the action plan. And really look forward to seeing that and being able to track the progress going forward. And just to note, just really hoping that we do get it in February 23, so that because it's on our agenda and we're expecting to see it then, so we'll look forward to that. And if you could also, so noting that this is a partnership action plan, so could you please let us know of the names of the lead officers from both health and social care who may want to come along and co-present on the 23rd. If you can just let us know who those would be, and we'll formally invite them. So thank you very much. Now moving on to item 7, which is the Child Queue Safeguarding Practice Review. So members of both Living in Hackney and Children and Young People Scrutiny Commission met to scrutinise the response to the Child Queue Safeguarding Practice Review. A letter setting out the key findings of the Commission and initial recommendations has been sent to lead officers at key partners for a response to London Borough of Hackney, Metropolitan Police Service, MOPAC and City and Hackney Safeguarding Partnership. The letter sent is set out at page 47 of the report. A further follow-up meeting with both commissions is expected in 2023 once City and Hackney Safeguarding Partnership have concluded their follow-up of the Safeguarding Practice Review and IOPC report has been completed. The response of partnerships will be published in the agenda of both Living in Hackney and Children and Young People Scrutiny Commissions. Do the members note and agree this item? Got loads of nods. Okay, moving on then to item 8, which is housing support for care leavers. Members of both Living in Hackney and Children and Young People Scrutiny Commission reviewed housing support for care leavers and have made a number of recommendations to the Cabinet appropriate member, which are detailed in the attached letter at page 59 of the report pack. The recommendations of the commissions are timely, given that the care leaver offer and housing strategy are both currently being updated. It is also noted that the experiences of care leavers will now also form a specific assessment by Ofsted as part of the inspection framework for children's social care. The Cabinet response to the recommendations is expected in January 2023, and this will be published in this and the Living in Hackney agenda, Scrutiny Commission agendas. Following up arrangements for the recommendations will be agreed across the commissions. Do members note and agree? Fantastic. And moving on to the work programme, which is item 9. The updated work programme for the remainder of 2022-23 is contained within the report pack at page 77. The main changes to note are the item on race, racism and social care has been subsumed into an item on support for young parents. This was after a long conversation with Diane Benjamin, and it maybe doesn't make sense, but it really did make sense when we were having the conversation. I think that we're trying to cover as much ground as we possibly can whilst being able to, you know, cut across areas that we have identified as areas that we're wanting to focus on, and the connection, just in case it may not be apparent to some people, is that young parents are more likely to have their children removed from their care, and they're also more likely to be Black and global majority, so there's a link between the two. And then the other change is the accessibility of CAM services is confirmed for April 2023. Cabinet Q&A, the Cabinet Member for Families, Parks and Leisure, Councillor Woodley, Q&A is in February, so the Commission will need to agree which topics it would like to focus on before Christmas, so we'll be getting in touch about that. And the Scrutiny Officer will write to members asking for their suggestions for Councillor Woodley's Q&A. Item 10, minutes. The minutes of the meetings held on the 29th of September and October 31st are attached for members to note and agree. Thank you very much. And any other business? We've just got our meeting on the 16th of January. Oh, we've got some other business.
I was just going to say it's really nice that Diane and Jackie have stayed actually for the send thing. I think it makes us optimistic about all the working together, because it's obviously overlap. Yeah, and naive. No, I know that makes sense. It's good, Diane.
Yeah. So yeah, we'll see you all again on the 16th of January. So season's greetings. I know, don't look. It's December this week. It's not. Good night, everyone.